Hello, welcome to the Assembling the Lifetime Patient Record. Let me begin by introducing you to Miss Jones. She's a 67-year-old woman with congestive heart failure and type 2 diabetes, and she's just changed to a new Medicare Advantage health plan. Her health plan, because they don't have access to all of her data, is giving her an innovative application to share her claims with her old claims provider, CMS, as well as connecting to her providers and clinics. Let me begin by giving you an overview of the whole vignette. After Ms. Jones signs up and downloads her application, she's going to reach out and get her information from multiple sources. This includes first CMS as the payer, and then she's going to connect to the hospital, which will be eye-to-eye. The hospital will share her information with Care Evolution as the HIE, and then the HIE will share this information with the patient using Smart on Fire. Finally, the clinic, again is eye-to-eye, will share the information directly with Ms. Jones. In all these cases, Ms. Jones will reach out using Smart on Fire. This is possible because with the Cures 2016 Act, most providers now are providing FHIR endpoints so that patients can sign up and get access to their information. In this case, we're going to get all of the provider information on Ms. Jones' behalf and then enable it to power the rest of the vignette. After she gathers all of her information, she's going to then share her information back with her health plan. We're going to do this using bulk FHIR. Bulk FHIR is an excellent format that's computable and shares her information with the health plan in a way that they can interpret it. Her health plan is going to identify key services that are valuable to her. They're going to identify the fact that she has got CHF and offer her a care management program around CHF to keep her healthy at home so that to avoid hospitalizations and ED visits. Additionally, based upon the fact that she has diabetes, they're going to recommend that she participates in the Progress oral hypoglycemic trial. She decides that she wants to enroll in the trial. This adds a new layer. So initially we had access to provider data. Now we'll have access to the data that Ms. Jones is providing herself during her daily life. We'll connect to Dexcom, which will provide her glucose information, as well as connecting to a Fitbit so we can see her daily steps and heart rate information. All of this information will be combined with the information from the providers, with the information she provides, and with the wearable devices, and that will help inform the trial. So as a result, once all of this is aggregated, we're going to share this information back to Scripps Research using OMOP. This has an advantage over FHIR because it doesn't require transformations. OMOP is a table format. It's much easier to analyze, and there's a number of off-the-shelf tools that can be used to interpret the data. So overall, we're going to show you a lifetime medical record generated from patient-mediated exchange. So we're going to connect provider information, claim information, and wearable information, all to improve Ms. Jones's individual control and convenience to participate in her personalized care as provided by the health plan, as well as make it easier for clinical trials to find out how to recruit her and how she would be interested. And when she participates in the clinical trial, this will increase the ability to provide real-world evidence to make the results of the trial more meaningful. So with that, I'm going to transfer over to eye-to-eye to talk about the hospital and population health.
Thanks, Brandon. And as Brandon was mentioning, on this first screen really is the flow of data. So eye-to-eye tracks, either at the hospital or clinic level, is then sending data, for example, from hospital to PICS, and then it's flowing directly into the HIE. And then our second screen is now where we get into the details of the data that's being submitted or being submitted. So with that, you will see, for example, Mary Jones. We're inside eye-to-eye tracks. Eye-to-eye tracks is the population health solution. It's an aggregate of all the data for Mrs. Jones across all those disparate data sources. And you'll see across the eye-to-eye tracks info is the view of Ms. Jones' historical values around her problems and medications and allergies, including historical values around vitals and labs and procedures and referrals. On top of that, too, external data in relation to encounters. So looking at Mrs. Jones and then looking at her visits at the hospital and the clinic level. So with that, I'll pass it back to you, Brandon.
Now that the eye-to-eye hospital has shared their information with the Care Evolution HIE, First, I'm going to show you Mary's record in the HIE. So first, you can see here her inpatient visit. This came from IHE, I2E, and they shared through PICS and XDS her hospital visit. But additionally, because we're using an HIE, we have access to additional information, including a behavioral health visit with her social worker for a change of job, and then a little earlier, a telehealth visit with Dr. Irene Jones for a urinary tract infection. Additionally, here you can see her problems, including her diabetes, which is why she will be recommended to the trial, and the heart failure that the health plan picked up to recommend her for the CHF program. You can see all of her providers, her medications, as well as her lab results. So now let's transition over to her health record. This is the application that she downloaded from her health plan. As you can see here, it recommends that she connects additional information. She goes into the tool and she's going to connect her CMS plan. So she searches for CMS and she finds CMS here. And because of the Cures Act, most providers actually would show up on this list. So most patients are able to find their provider or their claims providers. She's logging into the CMS website here using their Blue Button 2.0 connection. This is the CMS login screen that's going to establish the credentials. And as a result, we are going to get back all of her claims. So you can see here all of the data that we've received from the HIE, I2I, as well as CMS. Here is a good summary view of this information for Ms. Jones so she can rapidly see what's going on. To help us understand what's gone on in her history, we'll look briefly at the timeline view. Here in the timeline view, you can see the PCP visit from I2I that came directly using Smart on Fire for her diabetes visit, as well as you can see the encounter for the behavioral health visit with her social worker, including the screening tool that was performed. You can see her telehealth visit, the hospital visit that came through the HIE, and then you can see additional information, including here a colon cancer screening. And then as we go back in time, we can see all the benefit of the claims that we received from CMS that give us an extensive history. Now we can go to our dashboard and you can see it's been updated based upon the data that we've received from all of these sources. First off, it says good job because she had already done her colon cancer screening and it confirmed that, as well as completing all of her diabetes care. Then you can see the Scripps research study. Based upon her diabetes diagnosis, the tool is recommending that she finds out more about the diabetes program, which we'll speak about in just a few moments. And then finally, the health plan is recommending that she engages in a CHF program to keep her healthy at home and avoid her needing unnecessary ED visits or hospitalizations for CHF. So with that, we've pulled together her whole record. So now let me share with you how we send this information over to her health plan. We send this information over to her health plan using bulk FHIR. This is an easy way for the health plan and their team to analyze both her record as well as to look at the overall population. The FHIR record has maps to multiple different codes and is highly codified to make it easier for their team to compute on the data. So from here, I will pull up the FHIR record. These are 3 example resources in the FHIR record: her conditions or diagnoses, her observations, and her procedures. What you can see here is all of the diagnoses that we received from all of the various sources. But more than just the diagnoses, all of the codings that are possible for these diagnoses are here as well. So not only do we have a SNOMED code for change of job, but we also have the ICD-10 code. So however the health plan wants to perform this analysis, the coding system that they want to use will be present. The same is true for observations, so you can see her hemoglobin A1C from labs, as well as her blood pressure and weight, whether it be in LOINC or in SNOMED, and we can see the same thing for the procedures as well. So they have a robust way of looking at all of the information that Ms. Jones has collected on their behalf. So with this, I'm going to hand it off to Felipe, who's going to go over the experience in progress.
At the Digital Trial Center, we're helping define the new field of precision nutrition. Our first initiative in this area is the Prediction of Glycemic Response Study, or as we call it, PROGRESS. PROGRESS is enrolling 1,000 participants, 500 people with type 2 diabetes and 500 without, to understand individual level glycemic response over a 10-day tracking period. And we'll also be tracking over a 3-year period health outcomes using the EHR data. From our participants, we'll be collecting survey data, wearable sensor data, biosamples, and nutrition information, all from the comfort of their home. In return, we'll provide HbA1c values, genomics data, probiotics data, and glucose levels. This allows us to gather real-world evidence with passive data collection. What this means for Mrs. Jones is, after having learned about our research through her health plan, she'll express interest in joining the study. We'll send her an invitation email, but for purposes of the demo, we'll use a QR code. As the progress study loads, we'll explain to Mrs. Jones what the study is all about. We'll explain glycemic response and ask a few screener questions to make sure she's eligible for our study. We want to make sure her phone is compatible with the companion app to the Dexcom device. We explain electronic health records and ask her whether she's willing to share the EHR data with us. She indicates that she has been diagnosed with type 2 diabetes. We make sure she's not excluded for other criteria, and we let her know she's eligible for the study. She starts giving us a little bit more information about herself, and we walk her through the consent form. We let her know that she's eligible for Amazon gift cards for completing study tasks, which keeps her motivated and engaged with the study. We've summarized the consent form a little bit, ask her for her state of residence, which we use to show the appropriate consent forms. She'll go through this in her own spare time to make a informed decision. As she signs the electronic consent form, the My Data Helps app will store it on her account so she could download and refer to at a later date. She'll share the CGM device data through Apple Health, and she'll be onboarded to the study. Once she's onboarded, we remind her about the Amazon gift cards. At this point, she hasn't completed any study tasks, so she's at 0 points. Since she's in the My Data Helps plan, or the platform, she'll be able to view the same data she's previously shared through her health plan. This helps us give her a little bit more sense of transparency so she knows what data we'll be accessing. She'll start a few tasks, like the lifestyle survey. We use the My Data Helps platform to design the survey and build it in a low-code environment. She doesn't have to type much and just needs to select a few options for the questions we need. The next step for Mrs. Jones is to order a glucose kit. The glucose kit is a little package we put together which contains the Fitbit device, the CGM device, and a Nutri-Grain bar. The Nutri-Grain bar helps her see her blood sugar levels change, and we know that it's the same meal for all of our participants. We explain what the glucose kit contains to Mrs. Jones. She gives us her mailing address and confirms that she'll receive it. She earns a few more points. And the next step would be to connect her Dexcom device. We tell her what to expect from the 10-day tracking period, which includes wearing the CGM device and starting a food intake log. For the purposes of the demo, we're going to log into an alternative account for Mrs. Jones since she'll be a few days into the study. At this point, Mrs. Jones has already given us blood samples, saliva samples, a stool sample, all from her home. She's also been wearing the CGM device for a few days, as well as her Fitbit. As we can see, on day 7, she took 7,000 steps according to her Fitbit device, for which she earned 15 points. She's also logged her food, gaining 135 points for that task. She can also see the information about her meals. For example, if the Nutri-Grain bar was her first meal on this day, she'll see how the sugar levels change. And she can see how it goes up and back down within a certain period of time. If she switches to the rewards tab, she'll see how many points she's earned And in this case, she's already earned an Amazon gift card. On the script side, at the end of the day, we'll receive an OMOP data transfer from My Data Helps. This data transfer is available to us to load directly into our database. We don't need to write code to interpret or transform FHIR payloads, as you can see on the other screen. Instead of writing that code, we load the OMOP data directly into our database. This helps us use off-the-shelf tools from OHDSI and other organizations. The data scientists can also use our analytics platform of choice. For example, we can use Tableau to look at some of the data. The OMOP data keeps the source data, as we can see, for the procedures, which shows us a CPT code and the concept name on the OMOP model. We also see a hierarchy, which gives us a taxonomy we use for our analyses. For conditions, we can also see source data, in this case ICD-10, which are translated to OMOP concept names as well. We're given the same taxonomy and hierarchy for our analyses.
So this concludes the overall vignette. What you saw was Ms. Jones assembling her lifetime medical record by combining claims, provider information, and wearable data, giving her an increased sense of control over her data so she can determine where that data is being used. This data helps her with enhancing personalized care by working with her health plan that figures out which services will be useful for her, like the CHF program, as well as a clinical trial that might be of benefit to her and of interest to her, as in the PROGRESS trial for diabetes. And finally, from a clinical trials perspective, it helps find better matches for participants more easily anywhere they might be found in a more virtual environment. Additionally, she's able to provide data from her daily life using wearables and the Dexcom glucose monitor so that her daily life can inform real-world evidence into the clinical trial, resulting in more results that are more aligned with real life and not just clinical trial results. Thank you for your attention.